I'm going to show you how to find and treat active points on your own ears. Whether you're suffering from chronic pain, migraines, insomnia, or just the stress and anxiety of everyday life, this method can help you manage your own symptoms. Back up a second. The whole idea seems a little strange, but if you can imagine this, that every point on the ear acts kind of like a button that stimulates a nerve ending, and then that nerve ending takes a message to a very specific part of the brain. Let's say you have inflammation, pain in the knee, and you find an active point that represents the knee on the ear. Well, what happens is you stimulate a nerve ending that sends a message specifically to the part of your brain that controls and represents the knee. And then the brain, being the master control center of everything, sends a message to the knee saying, calm down the inflammation, and actually we don't need to be feeling this much pain. I'm Dave Maybee, Director of the Canadian Institute of Auricular Medicine. I'm here to guide you as you treat your own ears and see for yourself the effect that it can have. Let's get into it. First of all, what you're going to need is something that is relatively sharp, but not too sharp. I'm using a golf tee. The reason I'm using a golf tee is because I want something that is precise, but not too sharp, because you definitely don't want something that's going to pierce the skin. You don't want something like a pin, because that's going to break the skin, and you don't want to do that. So something that is dull, but sharp enough that you're going to be able to get a very precise point on the ear. In this first session, we're going to be just looking for active points, not really worrying about what they actually represent. In later videos, we're going to be very specific about conditions and what points we're looking for. But right now, we're just getting used to finding a point that is active, no matter what it is, okay? So what we're gonna do is we're gonna take the golf tee, press in different areas on our ear, actually quite lightly. When we're pressing, we're not pressing too hard, because if you find an active point, I guarantee you it's going to hurt when you find it. Why does it have to hurt? Well, remember I said we're stimulating nerve endings. Okay, so when you stimulate a nerve ending, there has to be some level of pain there. The pain that you create with the stimulation is a sign to you that you have found a good point. Okay, you don't have to create enough pain that you're making yourself really suffer. All you have to do is find a point that hurts enough that you know it's an active point. Poke around on the inner part of the ear, on the outer part of the ear, the lobe, even a little bit on the cheek, and even on the back of the ear. You definitely don't want to go inside the ear canal at all. Once you have found perhaps 4, maybe 5 points, that's about all you should really do in one day. The reason we don't want to do a whole lot of points is because each of these points that you're finding is quite profound, has a really big effect on the brain actually. So if you do too much, the brain is kind of, getting too much information, and it's going to just say, well, that's enough. And the whole treatment will be a little less effective if you do too much. Okay, so let's actually stimulate an ear point together. So I'm going to start with one ear. You can pick either ear, it doesn't matter, but it is a good idea to do a point or two on either ear, just so you feel balanced. What we're going to do when we find an active point is we're going to simply stay on it, and we're going to go in little circles around like this, without sliding on the skin, simply staying where we are, but go in little circles. So it's a gentle massage. Again, you don't have to press very hard. When you find a point, you'll know, because it'll stand out as being quite tender. Okay, and then you can just massage it in little circles. You do that for about 30 seconds. Or if you can't handle it anymore before 30 seconds is up, that's fine too. You do it for about 30 seconds to maybe a minute if you want to do it a little longer. You don't want to do it for too long because you don't want to irritate the skin too much. And then you can actually move on to a different point. Maybe look on the other ear. It's kind of a neat approach because it's a less is more kind of philosophy, which in a lot of things in life we're not really used to. We are choosing a point that is really well selected. And when I say well selected, I mean it's a point that actually hurts when you stimulate it, and you know that it's actually going to have a very profound effect on the brain. And so you want to check in with yourself after each point as well, because some people who are extremely sensitive, you do one point and you might start to feel a rush of energy, you might start to feel tingling, or you might start to feel a little dizzy or really relaxed, something like that. Well, that's a sign that you should probably stop there and that is enough for you for today. Everybody is a little bit different. Some people can take 6 or 7 points and still feel completely fine. But let's for now keep just 4 or maybe 5 as a maximum for every session. And then tomorrow you can do it again, stimulating different points. Every day different points will come up, and every day those points will be what needs to come up for you in that day. I hope you will join me for another ear stimulation session tomorrow as you take a moment to give back to yourself. You deserve it. To learn more about the neurology behind auricular medicine, behind ear acupuncture, please feel free to check out our video on the neurology of the ear.